Hello everyone, how are you doing? Welcome. This week I'm going to cover assessment for PHQ9 patient. Mostly this is a patient which is in a hospital setup or a nursing home, but you have to consider the scenario which you will be given during your Osce, because that's what gives you the objective elements that you need to cover. Now, for PHQ9 patient, in most cases, it revolves around depression, low mood, and things of that kind. So, for this case, you need to ensure your patient opens up because they might really not up to talking at all. Now, for this scenario, it's a 15 minutes skill. You will check your scene for safety. Or if it is the patient's room, approach the scene, do your hand hygiene using the 7 steps of hand hygiene. Then now commence. I'm Vincent Obita. I'm the nurse going to take care of you today. Kindly your full names, okay, and your date of birth. Can I confirm that with your can I remember the patient might not have a ID band if they are in a nursing home, and your address and the My State nursing home. During this period, the patient might totally not opt to even talk. Should the patient fail to talk, you can confirm with your details and also state to the assessor. From there, check for any allergies. Are you allergic to any medication, plaster or latex? Check for the reaction that normally follows that such exposure. After that, for pain, check pain in a scale of 0 to 3, where 0 being no pain and 3 being the worst pain. How can you rate your pain? Reassure the patient and also recognize their pain. After that, I'll go ahead and I'll request to take some of the observations that will help us manage you appropriately. Is that okay with you? Yeah. In the process, I'll also give you an outcome of assessment based on the patient health questionnaire. That is the PHQ9. Is that okay with you? Then request for permission to go and prepare your equipment, do your hand hygiene, then proceed to the preparation area. Back to the preparation area. Assessor is my tray. Are my equipments calibrated, clean and ready for use? Yes. Then I'll do a full hand wash using the using soap and water and the 7 steps of hand hygiene. After that, put on an apron, then wear clean gloves. Have your equipment, and in this case we are going to need a blood pressure machine and thermometer, tympanic thermometer, and our recording materials. This case we also need the observation chart and the PHQ9 sheet. With the two and your pen and hand gel, you go back to the patient. Seek for permission to proceed. Now, David Jones, I'm going to start various observation. Are you happy? We proceed. I'll start with the blood pressure and I'll use one of your arms. Which one would you prefer? Maybe the left one. Have you had any surgeries on your left breast or the left arm? None. So I'm happy to use it. Assessor, I'll place the cuff covering 80% of the arm, yeah, and 2 centimeters above the antecubital fossa. Use your 2 fingers to ensure you locate it nicely and cover 80% of the arm, and give your patient warning that they might feel some tightness around the arm while the pressure cuff is being pumped. Okay, in case you need me to stop, or if you can't bear with the pain, kindly alert me and I'll stop. Is that okay? Concurrently, while the BP is reading, take your temperature. Okay, now Jones, I would like to take your temperature. I'm going to use one of the ears. Which one would you prefer? The right one. Have you had any surgeries on the right one? No. Do you use hearing aid on the right one? Yes. Okay. I don't want to interfere with the hearing aid. Can we use the other ear if you don't mind? Yes. Then now pull the ear up and backwards. Check for any wax in compassion. Assessor, the ear canal is clear. I'm happy to use. Get your tympanic thermometer. Put it on. Okay, by pressing the button. It will blink, showing that it needs the ear probe. Pick the ear probe from the holder, and with the ear pulled upward and backwards, access the ear canal, slightly go in, and press the button. It will give a blip sound and give a reading, then report to the patient. Your temperature is 37.5. Then after that, even before recording, endeavor to discard this probe to the clinical waste bin. Even if it's far away or it's just next to you, ensure and you tell the assessor, now discard the disposable probe, the clinical waste bin. Press the blue button on top of your tympanic thermometer to discard it, and don't use that button while taking the temperature, because you'll poke the patient's ear with the probe when it's coming out. After taking the temperature and discarding the probe, note it down, is 37.5. 37.5. Remove the cuff. You will be having your reading by that time. David, your blood pressure is 128/62. Okay, now you are done with that one. Now we are going to take the pulse rate. Are you happy we proceed? Yes. This one is taken from your wrist. Which arm would you like me to use? Maybe the right one. Now, assessor, I'm checking for the radial pulse using 2 or 3 fingers. Then I've located in and start, and I'll request you, David, to remain silent during this period. It's going to be 2 minutes. Then after that, you can ask any question if you have, because I'll request you, I'll need the 2 full minutes to take your pulse rate. Now, as I'm going to start, then using your fob watch, determine the pulse rate for 1 full minute. The next 1 minute, count the respiratory rate. When done, and remember to wait for the entire 2 minutes. Your assessor will be taking note of that. When done, report to the patient that your heart rate is 77, your pulse rate is 77, and your respiratory rate is 17. Okay? Are you okay? Are you happy with that? Then report to the assessor. During the 2 minutes, I took the pulse rate for 1 full minute, checking for the rate, depth, and rhythm. Okay. During the remaining minute, I checked the patient's respiratory rate, checking for movement of the chest wall, and checking for any use of accessory muscles or any signs of distress, and there were none. I didn't tell the patient because it would have altered my readings. Remember to say that one. But even if you miss it, there is no big deal, but it's good to tell the assessor, because you can be there and you don't know even what you are doing. Yeah, and that's the assumption you want to erase from the assessor's side. After that, basically you are done with your set of observation. So you request to go to the preparation area to record your reading. So David, I'll request to leave. In case you need me, just call my name or use the call bell if it is a hospital setup or a nursing home. Exit the area, go place your equipment separate, remove your rip off your gown, remove the gloves, but remember, during this COVID period, the entire assessment is done with the gloves and the apron on, so you will just be verbalizing, but ideally you won't be removing them. Now go and record your vital signs. So for this observations chart for PHQ-9, you start with the year 2021. We go to date and month, that is 0809, and time, it is 1400. Then we proceed to the temperature. Patient's temperature was 37.5. Check at the 37.5 mark, and within the same line you are writing the year, make an X to mark the 37.5. After that, proceed to the blood pressure. It was 128/62. Check at 128, put an arrow. Then at 62, put an arrow. Then join them with the dots. After that, we had a pulse rate of 77. Check 77, and within the same line, put a dot, a visible dot, and ensure to make it visible. If in case it's falling within the same dots for the blood pressure, you can put it slightly beside the dots, but ensure it's very much visible for the assessor to see, or else you will be penalized. After that, followed by respiratory rate. The respiratory rate was 17, right, 17. Then for this case, it also requires the initials. You have VO, Vincent to Beta, and counter check all that you've done. Okay, when done with that one, go to your PHQ-9 sheet. It looks like this. It is also a pre-filled form at this scene. You need just to total. At 0, there is nothing. At 1, check for any elements that have been marked at 1. Check for any elements that have been marked at 1. Put your totals down here. Check elements that have been done at 2. Put your total. For my case, the total for the second column is 6. The first one is 3. Then for the third column, there is none, 0. Then now, after writing 3, 6, and 0, I give the totals together, which is 3 plus 6 plus 0, that is 9. So 9 is the PHQ is the score, PHQ score for this patient. After having that one, I also need to confirm. Remember, for this case, there is nothing to sign about. From the PHQ-9 score, any score that is above, is 5 and above, has a provisional diagnosis of depression. Okay, that's what you must give consideration. Any sign, anything 5 and above is a provisional symptom of depression. Remember, we don't diagnose depression from our side. It's done by the mental health team. So you don't give the patient the diagnosis of depression, but a provisional diagnosis of depression. That's what you report to patient. When done with that one, do your hand hygiene, then proceed to the patient. Now, David, I'm back. Are you happy I go ahead and give you the result of the set of the observation I've done? Yes. Can I have a seat? We have a chat about it. Yes. Then sit down and give your feedback. David, I took a set of observation and I'm happy to report that they are within the expected range. Okay. I also so I'll continue to monitor that one. If it is a nursing home, you continue monitoring for hourly. If the patient is at home, you will be monitoring it weekly. Okay. If the patient is in the hospital, just the normal observation, which is 4 hourly. Now, I also assessed you using the patient health questionnaire. Okay, and you had a score of 9. Okay, and this one indicates that you have a provisional diagnosis of depression. And remember, there are markings leading to that leading to that score. So it's those markings that you are going to explore so that it will help you in your nursing care plan. For this case, my patient was having little energy or disinterested. Then now let's assist the patient to open up, because this patient might be down and might not talk. If they have little interest or pleasure, now ask them what they would like to do. And again, you had had the history of this patient. Maybe they have preferences, maybe playing tennis, swimming, or playing cards, whichever hobby they might have. Explore that one. Encourage them to take part in those activities. And also remember, this PHQ9 patient, endeavor to refer to the mental health team. So David, I would like to refer you to the mental health team. How do you feel about that? Based on your PHQ9, I would like to refer you to the mental health team. How do you feel about that? They will ask you, what will the mental health team do? Then you have, they might organize for you some counseling sessions, okay? They can also encourage you, okay, to engage in certain group therapy sessions. They might also make some prescription that might elevate your mood, since your mood is currently down. Okay, so you have to take note of what the mental health team will do, because that's what the patient will ask prior to agreeing or giving consent towards such an intervention. Then also endeavor to ask them, the patient might have depression, maybe they have lost a loved one, a pet, or anything that is leading to their grieving, okay? Encourage them to express their feelings. Kindly, they can also give you an exploration of how they are feeling. They lost a loved one. Would they like to have their family members incorporated in the care so that they don't feel lonely? They get company of their children and things of that kind. Explore such. Any other elements that the patient might have, maybe loss of appetite due to depression, explore that one. I can see you also have poor appetite, okay? How many meals do you take per day? They might tell you. Advise them based on such elements. If they are overeating, also advise on the same. If the patient is having suicidal thoughts, you have to explore those. The elements to explore are all here. You need not to explore all of them during your assessment. Just pick one or two, because you also remember you are time bound, okay? So pick one or two that will help you in your planning. Remember, during this assessment, you've already been directed. Concentrate on the mood and also nutrition, okay? So you can explore the depression aspect or the low mood aspect and their feeding, okay? Their nutrition or intake. With those two, already you are good with your planning. After giving the patient all this information, okay, then request to leave. Are you happy? Are you feeling better? That's very much good, and thank you for your cooperation. Bye. Do your hand hygiene, exit. Tell the assessor you would clean the equipment, make them ready for use, for the next use, and you are done. And that's what it entails about PHQ9. What's critical? The health education, okay? So endeavor to clear your assessment quickly, then come back, discard, explore the patient's needs, because that's what it entails in terms of the patient health questionnaire. Also, endeavor to tell the patient, I'll continue to monitor you for hourly for the observations, and for the PHQ9 you do once a week, okay? Or advised by the mental health team, but it's done once weekly. Endeavor to tell the patient the intervals unto which he or she will be observed. And that's all about this skill. Happy? Thank you so much, and kindly continue to support my videos by subscribing to the channel and also liking and sharing. Thank you so much, and have a good time next time.